Hi everybody, this is Dr. Richard Shuey at Back to Health Chiropractic, and if you like what you're seeing on these videos, I hope you'll give us a call at 533-1201 and hopefully get a hold of us and you can talk to me about whether I might be able to help you with your headache. Okay, so we're on the second video in this series, and it's on everything you need to know about headaches. And what we're going to be doing in this video is we're going to look at some of the common ways that people are dealing with their headaches and the effectiveness of how we do that. The three major common ways that people end up doing it, and if you were to think of how you've handled it, you probably fit into one of these three categories. Rest and avoidance is one of the first things we do. Then we start looking at medications, over-the-counter ones, because they're easier to get. And then after that, we end up going in for professional help. So you end up going to your MD for the problem. So let's look at how they kind of stack up, how they work. First things first. I have to say that using rest is an effective means of in the short term. So if you're getting a headache, once every 3 months or something like that, you can actually get away with using this kind of technique here because it's not too much of your time that you're wasting. But if you are getting closer and closer to the chronic daily headache sufferer, where you're seeing 2, 3, 5, 10 days a month where you're getting headaches, this obviously becomes it's not effective anymore because you can't sleep away your life. I mean, how many days are you willing to sleep away? As for avoidance tactics, what that simply means is people will tend to stop doing the activities that are causing their headaches, or they'll have to do something else about it. Meaning they'll get somebody else to do that particular task at work if that's what it is, and they try to pick up other things. But these avoidance tactics, how many things are you going to give up? I mean, there's a lot of things that we love in our lives that bring, people will end up saying, like, let's say you're an avid tennis player and you're getting headaches from playing tennis. You don't want to give that up, right? Well, how many other tasks in your life are you just willing to take, to not do anymore? First off, by doing that, you create huge problems for yourself as well, and the research shows it. Over the last 5 to 7 years, the research has basically all come back saying that when you use fear and avoidance tactics to deal with the problem, so you get fearful of the headaches that are caused by them, and you use avoidance tactics to kind of avoid doing the things that are causing your headaches, we know that you increase the chronic problems that you will suffer in the future until you get over those avoidance tactics, start putting those things back into your life. And partly it's due to the deconditioning that happens. A large part of it is due to the deconditioning that happens because you stop moving your body, and now it becomes easier and easier, and less activity is needed to be able to strain and stress your neck, and that is why your headaches will come on. You'll find out more about that in the next video that I do. Okay, so if we were looking at those and find out that those were wrong, then most people end up going to dealing with over-the-counter medications. There are about $4 billion spent every year on medications for headaches alone. They usually fit into two categories if they're over-the-counter drugs. It's the drugs like Tylenol, which basically slow down the nerve conduction. So the nerves are irritated, and that's what's causing your headache. And it does work. Tylenol does take your headaches away, but it is never dealing with why the nerves are irritated. The second thing that people use is nonsteroidal anti-inflammatories, which are very effective in treating headaches as well because inflammation is part of the problem. There are issues with these things, of course. Neither of them actually cure the problem, do they? And they have many side effects. Nonsteroidal anti-inflammatories, for instance, there is 107,000 people every year who are admitted to hospitals because of GI bleeding caused from nonsteroidal anti-inflammatories. And 16,500 of them, and this number is low, by the way, because this is related to people who take these over-the-counter, these nonsteroidal anti-inflammatories for arthritis in their hands. This has nothing to do with all the other uses that are going on. So, 16,500 people die every year from these bleeding ulcers caused by these medications. So there are huge side effects, and it's just not good. So after people do that for a while and they're going, these aren't going away, and I'm getting more and more of these things, what do? They end up going to their MDs, and about 10 million visits are done every year to MDs for headaches alone. There's no other problem. The vast majority of these, 90 to 95% of these people, have what we call primary headaches. That simply means that the headache is the only problem going in. They don't have any bad diseases like cancer. They don't have any aneurysms in their brain or anything that's causing these headaches that needed to be ruled out. That's 90 to 95% of these 10 million people are having this problem. If you go to the doctor, that's one of the first things they're going to do. Is they're going to look at the bad stuff and kind of rule it out. After that, 90 to 95% of these people are going to be put on more drugs. And the other thing that they will do is they'll have some lifestyle changes. A trigger sheet is what it's called, where they're looking at, what foods are you eating, or wine, or cheese, or whatever. I'm going to discuss these because these are important things to look at. But at this video, I just wanted to look at kind of an overview of this sort of thing. So they end up going to more prescription strength non-steroidal anti-inflammatories like naproxen, that kind of thing. And to avoid the bleeding ulcers that are caused by those, they have also picked up something called Celebrex, which is something, it's called a COX-2 inhibiting drug. So it doesn't block the pathway that causes the bleeding ulcers. The problem is that Celebrex had two other drugs that were on the market at the same time. Celebrex came out. One was called Vioxx, and the other one was Bextra. And all three of these drugs are COX-2 inhibiting drugs. They just happen to use slightly different pathways. And Vioxx and Bextra were taken off of the market because of the strokes and the heart attacks that were being caused by them. And if it's a COX-2 inhibiting drug, and the COX-2 enzyme is obviously important in the health of your cardiovascular system, if you're blocking it over a long time, you're going to have issues. And I don't doubt that Celebrex will have something wrong with it. That is, there's side effects with every one of these medications. The other things that they end up doing is going into these other strange things that are effective, the antidepressants, beta blockers, vasoconstrictors, narcotic type drugs. The list is long of what they'll do to put medication into you. But the big issue, looking at over-the-counter medications or the ones that are given by your MD, let me ask you this. If you've done any of these things, and you've been doing it for, say, 6 months or something like that, are they helping you? If you were to get off those drugs now, would you have less headaches overall? Would the intensity of your headaches be less? I think that you're going to answer no, because these drugs are stopgaps. They kind of help you manage your headaches. Go to the other websites that talk about headaches, where the medical doctors and the established, what they're doing, and you're going to see that most of the time they're talking about it, that they know how to manage your headaches, but they never fix the problem. So I put this at the very end, the definition of insanity. This is a nice, I'm sure you've heard it before. Doing the same thing over and over and expecting a different result is considered kind of a definition of insanity, isn't it? Well, taking these medications to try to cure your problem when it hasn't cured you up to this point, isn't that a bit of insanity? All right. So now let's get on and let's look at actually what is causing your headaches, by the way. And by the way, if you like this video again, and you want to actually do something about your headaches, I hope that you'll give me a call at 533-1201. And we have a special that will help you to come on in, and it's $50 for your first visit. That's everything included in your first visit, the workup and your first treatment for $50. It's a great deal. I hope you'll call us, 533-1201.